I'm down in Garfield County. It's the peak of fall. It's gorgeous, gorgeous weather, gorgeous colors out there. And I'm excited to talk about mental health and the programs that we've been running the last year and a half. So currently, mental health is one of the biggest issues that we in Extension are facing across the nation. And Utah is no exception. We in Utah consistently rank in the lower part, near the bottoms, for prevalence of mental health issues and addressing to care in adults and children, or yes, adults and youth. So we kind of came up with this idea. We've worked cross-disciplinary. So we've got Josh Dallin and Jake Hadfield on our team, and we had 2 other members that have since left the university. And so we've got home and community faculty as well as ag faculty working on this program. And we've come up with this topic of UTAC, Utah Talks, Answers, and Connects, and maintaining fences. So we kind of have two names for it, but ultimately it's UTAC, Utah Talks, Answers, and Connects. So just like any basic extension program, we do always start off with a needs assessment. We have done several with adults, and then we did several with ag teachers. And we wanted to find out what resources are actually available to this age demographic, as well as youth involved in 4-H and FFA that come from rural communities that are participating in these ag-related organizations. And so we conducted these needs assessments, and we were finding that there wasn't really a curriculum specific to these groups. The traditional mental health usually includes very complex and long curriculum. The mental health first aid curriculum is an amazing curriculum, and I highly recommend everyone to take that, but it is an 8-hour course. To send you through this, or even producers, they're more than likely not going to show up, or they're going to check out because of it's not relevant to them. And so through these needs assessment and these feedbacks from when we've actually gone in and taught these mental health first aid classes, we've learned that these individuals don't want to identify themselves as having a problem, but they're more than willing to help someone. So that's also one of the implementations that we put into this curriculum. So we condensed kind of the major points into a 50-minute presentation, and we focused on Utah Talks, Answers, and Connects, and maintaining fences. But these 3 principles have that we've continuously found throughout research has been shown to help mitigate mental health and reduce that stigma. So talking, answering, and connecting people to available resources. And again, we were focusing on youth, so we did want to make it fun and interactive. As we move from the needs assessment and building the program and overall the evaluation of this program, the verbal feedback that we received from these kids has been so positive. If you tell a 16-year-old kid they're going to go listen to mental health, they're probably just going to roll your eyes at us. But we were able to break down a lot of barriers and have some really good and deep discussions with these kids. Some of these kids even brought personal stories and perceptions of their own lives and experiences regarding mental health. And so again, we're giving these kids an area to feel comfortable in so that they can express and talk about this. And that's ultimately eliminating the stigma around mental health. So within the curriculum, this is kind of the bulk of what we cover, is the obstacles to better mental health. Like I said, I'm in Garfield County. One of the biggest obstacles we face is the lack of services. We have to drive an hour and a half to go to a larger community that has these services. Panguitch is on the very west side of Garfield County, and we've got 4 hours of Garfield County east of us. So even individuals in my county still have to drive up to 3 hours, 4 hours to get mental health services. We also talked about signs of stress. In individuals that are in agriculture are dealing with stresses on a daily basis. And these youth are also dealing with a lot of stress and issues. They've just came out of the pandemic. They're dealing with bullying. They're dealing with self-confidence. There's the other issues specifically related to ag. We're dealing with extremely strange weather. We've got the drought, but then we just got hit by a major hailstorm and a lot of crops were destroyed. So there's lots of stress, and there's ways that we can recognize the signs of the stress. And then we go into a little bit more detail about the specific mental health disorders, what classifies as a mental health disorder, and how to recognize the differences between them. A lot of the times, when we would teach this section, we've got a really cool slide that Tasha had come up with, and it listed a lot of different disorders, and the kids were like, well, I didn't realize PTSD was a mental health disorder, or I didn't even know that bulimia is related to mental health type of a thing. And then we covered mental health prevalence. An activity that we did was we would calculate the attendance of the kids and do our 1 to 5 ratio and have these kids stand up in that group. And 1 out of every 5 kids in Utah has seriously considered suicide. And so we talk about that there's a lot of individuals going through similar situations. And then ultimately we cover our UTAC talk. How do we talk about mental health? How do we look for and ask about signs and symptoms? And then we answer, how do we find solutions when someone is struggling? How can we provide that service based off of our needs assessment? Again, this group really wants to help others. They don't necessarily have a problem, but they're willing to step in and help. But how can they find solutions when someone they know is struggling? And then connecting them directly to the resources that are available locally as well as statewide. The overall program implementation, we've been able to do this a lot of different times, but we were able to get into the FFA organization through their COLT training, which is their chapter officer leadership training. And so this is specific to the leaders of each chapter, but we taught over 300 youth. We've implemented this program in 4-H with the state contest. We've gone into FFA classes, but we wanted to ensure that this again was a very hands-on and relatable topic. We don't want to just stand up there and lecture these youth about mental health. And so we came up with this hands-on activity about building a fence. A fence is very relatable to everybody in agriculture. We're trying to keep our products, our animals safe and secure. We're trying to keep predators and pests out. And we have to be checking in on our fence on a daily basis. We don't want to have holes. We don't want to have weaknesses. How can we improve those things? And so we gave these kids, and in this picture, that's what they're doing, is they're building fences. We went to our extension closets, cleaned out whatever we had, popsicle sticks, wire, pipe cleaners, paper clips, whatever we had, and we just put it on a table. And we gave these youth the objective to create the strongest fence possible, and gave them about 5 to 10 minutes. And so this was really fun because it was kind of a team building activity. It was an icebreaker. It got the kids interacting and having fun and really working hard on building the fences. And then as a facilitator, this was my favorite part because I got to go break the fences. So I would go stomp on them. We had one of the gavels from one of the state FFA officers, and we'd just go poke a hole in these fences. And the kids were devastated. They were like, "Why would you do that, Callie?" And so anyway, it's like, okay, well, you have a hole in the fence. What are you going to do? So we gave them another couple minutes to fix the fence. And then we brought them all back together and talked about what had happened. So we related us going and breaking their fence to possibly some situations that they've experienced on their own farm productions. Is a bull ran through the farm or ran through the fence. Little brother backed up and broke the fence down. I'm guilty of that in high school. One thing that I know ranchers out in the West Desert struggle with is hunters come in every time about this time of year and they cut the fence line, and they're trying to gather all the cattle to one spot, and they end up finding there was a hole in the fence because the opening deer hunt had just started. So we gave the kids that opportunity to talk about stressors that they are dealing with on a daily basis, or what their parents are dealing with their ag production, and just had a really good discussion. But then we transitioned to how ultimately we can fix the fence. So this is the picture of the most reliable resource available on the farm, right? This is our baling twine, and it was really good to have visuals. So when we taught this class, I had all of this equipment up there with me. But baling twine, you look out my window and I could probably find our pile of baling twine type of a thing. This is a accessible, easy to use, and it's almost everywhere. And so we related this product to our friends. This is our siblings. This is the kids we are going to high school with. This is our first step and our first resource into maintaining our fence. So if we've got a hole or a stressor that is causing us grief, we can go and address this with our friends. We can just talk about it. But sometimes this isn't going to fix it all. It's not a permanent fix. If it's a continuous stressor and there's going to be a hole, we need maybe some more reliable equipment. And so that's when we'd pull out the pliers and the fence stretcher and the post pounder, and we'd say, okay, what are these tools? They're like, well, that's how you build a fence. That's really going to fix your fence. And so we related these items to more of our extension agents and our ag teachers, maybe a school counselor or a parent, maybe individuals in these hope squads that are in most of the high schools across the state. These are the individuals that have had some type of training to assist with mental health. Again, these are available. They're not as convenient and available as our baling twine, but this is a more permanent fix to what our stressor or our hole is in our fence. And then ultimately, if the bull continues to get out, if the hunters continue to break our fence, the baling twine's not working, the fence stretcher and a new wire and a new post is not working, we call in the big dogs. We call in those professionals. And these are our professionals. These are our mental health professionals that we can get access to through hospital or the health department or through private agencies. And at some point, if this issue or this stressor is continuous and causing major problems, this is okay to call in some professional help. And then the other really focus that we wanted these youth to be able to relate to is real life examples. This is it. I've put a picture. This is my daughter and her show calf last year, but I put this picture in because I related a story when I was a FFA student that I had to work one night and my dad was home and I called and said, "Hey Dad, I got to have my calf fed. Would you go feed him?" And he said, "Yeah, for sure." And the next morning I'd shown up to feed my calf, and a calf that was overfed and not used to those rations. What happened? I'm preaching to the choir, but I found a bloated dead calf. And as a 16-year-old that has invested all this money and time into this project, I was devastated. I was frustrated. I was mad. I cried. I got to miss school. But I was able to relate a high stress situation to these kids and have a discussion of what stressors they're facing. And so again, we're having that open-ended conversation of what are you experiencing? What are your parents experiencing? And we had scenarios such as you see a chapter member kind of being resistant. They're usually happy-go-lucky. Just be sure to go out and reach out and see if any issues are there. Another example was trying to identify a physical injury versus a mental health disorder or injury. I gave the example of if I was standing up in this class with a sling on, you'd say, "What the heck did Callie do?" Right? You'd ask me what happened. I'd say, "Well, I dislocated my shoulder." And they said, "Oh, well, let us come help do your chores, or let us come feed you, or let us babysit your kids." There's a physical sign that I am hurt and injured and need help. But then I transitioned and I said, okay, what if I had PTSD? What are the signs that you can see? And again, that just opened up some discussion to, we really can't see these issues, and we've got to train ourselves and recognize these signs and symptoms so that we can, again, go talk to them about this about their disorder or their needs or their stressor, and we can help answer some of these questions, and we can connect them to resources available. And then lastly, some of the highlights that we did was we did give them an incentive or thanks for participating. Here's a hat. And this was our takeaway, was wear this hat, and when people say what the heck is UTAC, bring up mental health, and you as a FFA chapter leader can start that conversation right there and continue to break down that stigma. This curriculum has been taught to 4-H professionals that are county faculty, county staff, after school training, and we have been able to get into some other youth groups. I'm looking forward to getting into my high school specifically, because 90% of these kids could relate to these topics. So I haven't looked at the chat, but I just kept on talking. So I guess we'll open it up for questions or clarifications. And